to our presentation today on some basic first aid, just some, very basic. And we're being recorded today by Air Public Access, so welcome everybody who's listening in. First aid is the first and immediate assistance given to any person with either a minor or serious illness or injury. With care provided to preserve life, prevent the condition from worsening, or to promote recovery until medical services arrive. Why just some basic first aid is broad. First aid is broad. The first immediate assistance is given. Today we will focus on first aid that just about anybody can do, with some basic tools and knowledge and where to go to get more training. We hope you find this information empowering. What we'll cover today is, first we have Air Fire Department here, one of our first responders, and they will kick us off with some insights from their work. And then we'll talk about setting up a first aid kit, some basic wound care, sprains and strains, discuss some guidelines on when and where to seek further medical care, show a video on hands-only CPR, and provide you with some information on CPR and other first aid courses. And then we're going to have a raffle at the end for our little first aid kit here. Very convenient to keep at home or in your car or when you travel. So. Okay, so now I'm going to invite our Air Fire Department spokesman to come on up.
So good afternoon. My name is John Bresnahan. I'm a captain with the Air Fire Department. Just wanted to come up and give you just a quick couple minutes about what we do here in Air. Air is an ALS ambulance service, so we operate 2 paramedic level ambulances here in the town of Air. We provide EMS care to the members of the town here. So when somebody calls 911, they're going to get an ambulance from the town of Air. So it is our ambulance. We respond. It's funded by the tax dollars that you put in. So I was asked to put out and dispel a couple of untruths about first aid. So the first one I want to talk about is tourniquets. So there's been a lot of discussion recently about Stop the Bleed and items that we can use. So a commercial tourniquet is 100% safe for anybody who has significant bleeding. So there's a class out there called Stop the Bleed. It's about 2 hours. They teach you how to do wound packing and how to apply a tourniquet and use some direct pressure. But one of the myths we wanted to kind of dispel with this is if somebody is bleeding significantly and you can't stop it with a little bit of direct pressure, the best thing to do is to apply a commercial tourniquet. So they're available everywhere. You can buy them in most of your hunting and sporting goods stores. You can buy them online. Just make sure to buy a name brand one. So they're the ones that are going to hold up to the stress of having that tourniquet applied. So again, a lot of rumors and myths about tourniquets were out there for a long period of time where, hey, if we applied a tourniquet, the person's going to lose that extremity. That is 100% not true anymore. We have mountains and mountains of data from Afghanistan, Iraq, all of those places that have shown that the application of a tourniquet will save the person's life, and most likely if that limb is savable, they're able to save that as well, as long as they get to the appropriate level of care. So that was one of the big myths that we wanted to dispel. The second one is CPR. So CPR is very, very, very important. All of the stuff that I can do as a paramedic does not make a lot of difference if that person doesn't have CPR. And that starts with folks in the public. So you see somebody go down, there was a lot of, again, myths out there about doing mouth to mouth, right? So that has gone away. We found that the most important thing for CPR is to push on the chest, hard, fast, and deep, to provide those good chest compressions, which you're going to see here in the hands-only CPR video in a little bit, will make that person have their best possibility of survival until EMS gets there. So the early activation of EMS, you see somebody who is down, who's unresponsive, call 911 right away. the dispatchers, the people that answer the 911 calls, are going to start talking to you and talk you through how to do CPR. And then pushing hard and fast on that chest is the most important thing that we can do for anybody that we find who is unresponsive and doesn't have a pulse. So those were kind of the two big rumors that we wanted to dispel from things that have been out there for decades. Tourniquets have been out there for decades, CPR has been out there for decades, but we have a lot of really good science and data that explains to us, hey, this is how we should be doing this. These are the things that are going to save lives. So the early application of tourniquets to somebody who's bleeding and we can't control it, guess what? If they don't end up needing it, we can take it off. We have that ability. So most of the time, if you apply a tourniquet pre-hospitally, we're going to leave it on until we get to the hospital. We have relatively short transport times. You're talking an hour to a hospital that has trauma surgeons available to us. And then CPR, the earlier that person starts with CPR, the better the chance of survival. About every minute without CPR drops their survivability by about 10%. So the earlier CPR we start, the better the chance that they would have a positive outcome would be. Do you have any questions that I can answer for you?
I do. You talked about a commercially available tourniquet. If you don't have access to one, is it better to use a belt or a rope than to not use one?
So you want to use it, the commercial device is the best.
Sure.
So if you don't have something available, you want something that is wide, so like a belt or a strap of some form. You don't want to use a string or I've seen the shoelaces or a piece of rope. You want to use something that's a little bit wider, because if I use something that's too narrow, it actually crushes the tissue underneath, and that can 100% cause damage. But if I use something nice and wide, they recommend between at least 1.5 inches wide. So your standard belt is about 1.5 inches wide. And then you need to be able to twist it or compress it down tight enough to get that to work. So taking it like we see in the movies and just pulling the belt as tight as you can go isn't going to be effective. You actually have to put something in there called a windlass, and that can be any solid object. So like a screwdriver, a large piece of wooden dowel, something like that that's not going to break, and just twist that tight. And you just twist that until they stop bleeding. So yes, you can use non-commercial devices in that situation where I don't have one, but again, a commercial device is readily available now. They're actually quite cheap. They're about $15 to $20 now. So, good. Any other questions that I can answer? That's it. So, thank you for having us come down.
Thanks so much, John.
All right.
John.
We appreciate your time. That was great.
Okay, thank you, John. So now some basic wound care. The first thing in basic wound care is to wash your hands as well as you can. Usually people say happy birthday, sing happy birthday while they wash. Try to get under your nails when you clean. Try to rinse them well and dry from the fingertips up. So washing really good soap and water is a great way. And also to wear some gloves when appropriate. If you have them handy, that would be good, especially if there's a lot of fluids, bleeding. And next, what you're going to try to do is stop the bleeding. Minor cuts and scrapes usually stop bleeding on their own. If needed, apply gentle pressure with a clean bandage or cloth and elevate the wound until bleeding stops. And as John was explaining about the tourniquet, well, that would be for major bleeding, and he filled you in on that very well. The next thing you want to do is clean the wound. Rinsing the wound with water. You can use some antiseptic cleaners if available, but you want to be careful you don't use anything too harsh, like alcohol peroxide. And keeping the wound under running tap water will reduce the risk of infection. And you can wash around the wound with soap, but you don't want to get soap in the wound. Like I said, don't use hydrogen peroxide or iodine, which can be irritating. And remove any dirt or debris with tweezers that have been cleaned with alcohol. And if you can't move all the debris, you want to see a doctor. And after that, you want to apply a thin layer of antiseptic ointment or petroleum jelly. And that's a very thin layer. It's just to keep the wound moist. And that is to prevent some scarring and decrease the chances of infection. The next thing you want to do, but if a rash does appear from the antiseptic ointment, you want to stop using that. And then you want to cover the wound. Apply a bandage, rolled gauze, held in place with paper tape. You want to keep the tape away from the skin, and you want to keep that wound covering clean. If the injury is just a minor scrape or scratch, you can leave it uncovered. And you want to change that dressing at least once a day or whenever the bandage becomes wet or dirty. On getting a tetanus shot, usually it's every 10 years, but if the wound is very dirty and you haven't had a tetanus shot in over 5 years, you might want to consult your doctor because they might want to provide you with another one if it's deep and dirty, the wound. And then at that point you want to watch for signs of infection, see a doctor. If you see the signs of infection on the skin or near the wound, and those signs would be redness, increased pain, drainage, warmth, or swelling. Okay, and next we're going to talk about what to have in your first aid kit. Okay. And this one here is kind of neat because it comes with, I don't think I have that slide in there, do I? Some bandages, some tape. It even comes with scissors, a little book. Like we have some nice books on the back table that John brought. Band-aids. There's no ointment or any kind of pills in here. Because we can't really give those out. But a lot of people in their kits have Tylenol or ibuprofen or something like that. But just to give you an idea what should be in there. Enough gauze for cleaning wounds, okay, is always good. Band-aids, of course. Rolled gauze, and maybe an ace bandage if you ever get into a spot where you need one of those. Some antiseptic wipes are good in case there's no water nearby. A little ointment, antiseptic solution, and let's see, little scissors, tweezers are always good. And you should make that first aid kit to fit your family's needs. If it's at home, you have a family of 4, you want to make sure there's enough supplies in there. If it's one you want to have in your car, things you might need for that instance. And if you have somebody who has allergies in your family, anaphylactic, you want to have an anaphylactic pen in there, okay? So now we'll talk a little bit about sprains and strains. And the key word to that is to remember to, if you suspect a sprain or strain, you want to, of course, call your doctor and get that evaluated as soon as you can. But in the meantime, rest, ice, compression, and elevation. And what a sprain is a stretch or a tear in the ligament. And sometimes you don't know what it is until you get an x-ray. So that's why I say call your doctor. Symptoms of a sprain include pain, bruising, swelling, and inflammation. And a strain is an injury to a muscle or a tendon. And these symptoms could include pain, muscle spasms, muscle weakness, swelling, and inflammation. Both of these categories have mild, moderate, and severe levels. And one is not technically worse than the other. They're both uncomfortable. And like I said, you might need an imaging test, an x-ray to make sure there's no fracture there. So when you rest, you want to avoid activities that cause pain, swelling, or discomfort. And you always want to follow your healthcare provider's recommendations for activity levels. So they might not want you sitting around all day, but they might want to recommend how much activity you do. Ice. You want to apply a cold compress or an ice pack to the area as soon as possible, several times a day for about 15 to 20 minutes at a time. Being careful to use a towel or a thin cloth between the ice and your skin so it's not directly touching your skin. And you want to repeat that every 2 to 3 hours while awake for the first few days after an injury. And then compression to help stop the swelling. You want to compress the area with an elastic bandage until the swelling stops. Don't wrap it too tightly or you may hinder circulation. And you want to always begin wrapping at the end farthest from your heart. And you loosen the wrap if you have pain in the area, numbness or swelling that is occurring below the wrap. And then you want to elevate that area, injured area, above the level of your heart, especially at night, which allows gravity to help reduce swelling. And now we have a video showing a little bit how to wrap a foot or ankle. So we'll show that next.
Hi, my name is Kevin. I'm an orthopedic surgeon here at San Antonio Orthopedic Group. I specialize in disorders of the lower extremity and the foot and ankle. Oftentimes patients sprain or strain their ankle and have some swelling or some support issues in what
Well, we'll see.
Hi, my name is Kevin Kirk. I'm an orthopedic surgeon here at the San Antonio Orthopedic Group. I specialize in disorders of the lower extremity and the foot and ankle. Oftentimes patients sprain or strain their ankle and have some swelling or some support issues in which they often want to wrap their ankle. And so what we're going to demonstrate today is how the proper way to wrap your ankle. Ace wraps you can buy at the store come in all different sizes. This is goes from 1 inch to 6 inch, but the typical person would usually require a 4-inch ace wrap, which is this one right here. And with the help of my certified medical assistant, Deidre, we're going to show you how the proper way to wrap your foot and ankle. You start here at the base of the toes, and you do one small wrap around. And you want this to be relatively snug, but not so tight that it's going to cut off your circulation. And then you wrap it up, and this is called a figure of 8 wrap. And you wrap it around your ankle like this and back down, and then you just continue to repeat that sequence of a figure of 8 wrap. And what you can find is you can pull the ace wrap a little bit more snug to not only give you support, and you can support it either from the outside or the inside, whichever one that you feel that you need it the most, or to give it a little bit extra compression. And these newer ace wraps have the Velcro already in there, and you can see is that you have this nice figure of 8 configuration with the ace wrap. This is good for support of your ankle as well as to control the swelling. However, if you continue to have symptoms after 5 to 7 days, it may be a sign of something more serious, and you may want to consult a doctor.
He does such a nice, neat job. And if you can always unwrap and try again if you don't get it right, right?
Never wrapped that well.
Okay. Alicia, do you want to pass out the forms for when and who to see for common medical conditions?
Yes, I would love to.
Okay. So there's a lot of confusion these days about when you should go to your doctor, when you should go to urgent care, when you should go to the ER. So we'll talk about that a little bit for clarification. And of course, there's always other factors involved, like a holiday, a weekend. So this is just a general guide.
Right.
Okay. And one thing, as far as your regular doctor goes, if they're not around, usually if you hang on the line, press the right buttons, you can get through to an answering service and they could get a covering doctor for you. Just so FYI. So when you should see a primary care. So small things that can wait a little bit. Earaches, if they're not too terrible, cold and flu symptoms like a cough, congested, a low-grade fever or sore throat, urinary tract infections, as long as they're not making you too uncomfortable, if you can wait to see your doctor, pink eye or conjunctivitis, minor cuts and burns that you might be worried about, and non-life-threatening allergies, a little rash that you're concerned about. If it's not bothering you too much and it's on an extremity or something like that, then you can wait for your doctor. A slight respiratory infection, and of course your medication refills. those are all good things to talk to your primary care about generally. And urgent care, if it's a little more serious, can't wait for your doctor, you can't get an appointment. Urgent care is a good alternative for that. A little less expensive copay for the most part for your insurance. So wheezing or mild shortness of breath, sprains or strains, minor burns without blisters, small cuts that may need stitches, fevers without a rash, flu symptoms that are a little more extreme, eye discharge, vomiting and diarrhea, painful urination or an animal or insect bite, or minor allergic reactions. Now the ER, that is some place you want to go when you have chest pain or difficulty breathing, weakness or numbness on one side of your body, slurred speech, vision problems such as double vision or loss of vision, severe dizziness, broken bones or dislocated joints, head injuries, loss of consciousness, fainting, confusion, seizures, burns with blisters, severe abdominal pain, uncontrolled bleeding, larger cuts that may require stitches, fever over 103 degrees or fever with a rash, vaginal bleeding during pregnancy, poisoning, or a mental health crisis. So those are the instances you want to go to the ER. Yes?
a question?
Yeah.
I'm not really sure that I understand what the difference is between urgent care and the ER, honestly.
Well, ER is usually for more serious things, if you have trouble breathing.
What is urgent care? What's the difference between that and
Urgent care
emergency
won't
room?
have all the testing equipment like an ER will. It won't have the lab facility right there sometimes. So basically, if it's something that's bothering you but you can't see your PCP but you need to be seen, you want to go to an urgent care. If it's something serious that you feel you're going to need more testing, more expertise, you
Do
go
they
to
exist
the ER.
in this region?
Littleton has one.
Oh, this, yeah, Littleton has
Or a
one.
minute clinic is also
In
one.
the air, exactly.
Yeah.
Not so much, but
But emergency rooms are in hospitals.
yeah, like Circle Urgent Care, all the ones you see in the malls now are all urgent cares, and the copay is usually a lot cheaper than an ER too. But if ever you're in a situation where you're having shortness of breath or something major, you want to call 911. Actually, don't drive yourself to the ER in that case. So we have a video here next on hands-only CPR.
If you see a teen or adult suddenly collapse, it is important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to ask someone to call 911 and to get an AED, or call 911 yourself and put your phone on speaker mode so the operator can assist you. Then get directly over the victim. Put the heel of one hand in the center of the chest and put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive, or the rate of music you're listening to right now. Let's hope you never have to use hands-only CPR. But know that CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. Again, if you see a teen or adult suddenly collapse, don't be afraid to start hands-only CPR. Remember, call 911 and ask someone to get an AED. Then push hard and fast in the center of the chest until the AED and help arrives. Your actions can help save a life.
Taken a CPR course before and did that on a
long time ago.
Yeah, you have to press a lot deeper than you think, huh?
Yeah.
Yeah. So don't be afraid. Unfortunately, you might hear a cracker
Yeah.
too. Yeah, but so I have some handouts. Alicia, you want to give the handout for this one? Keeping Alicia busy.
Yeah.
There are formal CPR classes, And there are other life-saving courses. So the formal ones where you can get a certificate are the Red Cross, American Heart Association, and there are quite a few more online as well. But those are the major ones. And I also wanted to tell you about a free CPR training in Leominster. You don't get a card for it per se, but you have the education, you have the information. So it's offered on second Saturday of the month, and they start at 9:30 in the morning, and it's free. And they teach you, like it says there, CPR for adult, child, and infant, and they teach you how to use an AED, and for choking for adult, child, and infant too. So they'll teach you the Heimlich and some other choking. It's a really good course if you can get over there and take that. And it's absolutely free. Yes, Tim?
What's that AED?
That is the device that a lot of times you see in places. It electrifies and brings your heart back to the beat. It's a little zapper. And they teach you how to use that. So that'll be handy. Because a lot of places have them all over now.
Gyms.
Yep. Alrighty. I think that's about it for today. So we passed out some handouts for you, and now, and a raffle ticket. So now we're going to pick the winner of the raffle. So, let's see. Alicia, you want to pick this out? Oh, let me let Cindy.
We have a question.
Oh, sure.
I have a couple of questions.
Absolutely.
Just when you had said something about the strains, and I know you had said the rice is that just sort of like general for all strains? Or is it, because sometimes everyone always, like, when you do something with your back, it's technically a strain, but then everyone's always saying you've got to heat your back, put your heating pad on. Would you,
most of the time they recommend ice.
Really?
Yeah.
Do the ice even on
It's
your
for the
back?
inflammation, yeah. Because the inflammation, a lot of times, is what's causing the pain.
Yeah.
So usually the doctors recommend the ice.
To do the ice.
Yeah.
Everyone's doing because it feels good.
It feels good, yeah.
But the ice will really
And your
actually do
doctor,
something.
I've known some doctors, they say do ice and then heat to get, alternate. It kind of is whatever feels good sometimes, but generally speaking, they would say ice.
Ice might actually do something. Okay.
You want to pick one?
Initially. And then another question I had was, you said about primary care, and it's kind of a question comment. I think a lot of people, unfortunately, run to urgent care and run to the ER because there is a problem getting into primary care. I know that even my primary care sometimes, well, first of all, my primary care is in Boston. I have no problem getting there, but it's, there's a bottleneck. So at what point, if I'm sitting in pain and my doctor can't see me for 2 days, I'm sorry, I'm going to go be a bottleneck at the urgent care. And then this is causing more of a problem for the ERs and everything else. So, when you say reasonably wait, what do you think is reasonable? And I'm not saying you.
Right, I would say it depends on the
confrontational.
situation. Like, for example, one of the things in there was an earache. If your child has severe ear pain, and you can't get into the doctor to see them right away, well, you're going to go to an urgent care to help with. So it all depends on the situation. If you can't wait, then you go to an urgent care and get looked at.
Your PCP also has a triage nurse that can help you decipher when to wait and when to go.
I think it's just, honestly, in the past with my primary care, and even now, like, I really like what I've got. I just don't have good faith in any of my primary cares. Like, I just don't feel like when I have a cold that I have somebody that I can just get to see me. Like, I'm either at a minute clinic or I'm at urgent care.
That's more the case these days.
And it just stinks because I want to see a doctor. My actual doctor. And that should be my front line, right?
That would be nice. That's how it should be. Unfortunately, these days, it's hard.
And then
there's not enough doctors,
sometimes
I guess.
I feel like as a patient/customer, because in some ways, I am seen somewhere at pharmaceuticals, seen as a customer. I am frowned upon by using my rights to go to urgent care or bypassing things because I can't get into my PCP. Do you know what I mean? Because well, that everyone knows what I'm talking about. You know what I'm talking about, Cindy. Like you should go to your doctor if you have a cough, but I can't get in.
Right.
So why are you here?
Yeah.
Because I can't get here for 2
Right.
days. So there's
No,
a
you have every right to seek medical
I
care
understand
as
what
you
you're saying
need.
here on
Yeah.
the paper, but
Yeah.
it's hard.
No, it's just some people. There are some people that go to emergency room automatically for
Exactly.
anything.
True.
So that's kind of
Well, I know, and I don't do that. I'm like the last person. I've
Yeah.
been in way too many. I'm like the last person who ever wants to go
I was thinking
anywhere.
about that when you were talking about like a urinary tract infection,
Yeah.
that it can wait. I'm like, oh yeah.
Yeah,
Who has
I know.
ever had a urinary tract infection?
It can't
Where
wait.
they thought it could wait.
Right.
That cannot
Well,
Yeah, I
and
know.
you're always like,
Yeah,
it's
it's
unusual,
pretty
but
it's
it's
burning though.
Yeah.
It's not like.
Yeah, there are different degrees of everything.
Right,
I suppose. Yeah.
So true.
Oh, you picked one.
I know.
Okay, we have a winner
Who's the
here.
winner?
Let's see. Okay, you guys ready?
Yeah.
804284.
It's not me.
Huh? No? No? Tim, is that you? Tim,
Is it you?
Yes.
Oh, you win.
Tim.
You're a winner. Yes. Yes. Thank you.
I'm thinking we don't have to take it.
Yeah.
That's how lucky you are.
I'm still alive, so I got some cow luck.
Yeah. All right. Well, thank you, everybody. Does anybody have any more questions? All right. Well, thank you, Air Public TV, and I think the fire department left already.
Yeah,
Yeah.
but thanks to
We
the Air
thank
Fire
them.
Department,
Yes.
thanks to Stone Soup Kitchen for
Yes. Thank you,
hosting.
Cindy, for having us.
Oh, thank you for coming. We appreciate it.